I see a really positive future, but there is, and there has been over the last couple of years, a significant threat: the funding of training. Our applicants come to the course with a psychology degree, and they come carrying what is a significant debt. So if they come with approximately 40k's worth of debt, and then they have to go on to a doctorate programme, which is 3 years with a high fee and with a relatively high fee and another 3 years of living, they could end up with a cumulative debt of over 150k. If that is allowed to happen, then I think it really does threaten whether we will attract the number of people, or indeed the number to fill the places. Because at the moment we have a high level of applicants, a quite high quality applicant, but actually if you withdraw that funding and convert it all to loans, you really do threaten the future of clinical psychology. Clinical psychology has had a major impact in the delivery of healthcare. We have been working quite hard to point out the difficulties if a new funding regime is introduced, how it will impact on the health services' ability to deliver their strategic plans for mental health care.
The areas that I think we in the clinical division are particularly interested in are liaising with government and policymakers, and both the society and clinical psychology raising its game in being much more organised in the way it influences government and policy across all the 4 nations. I think the society has a really important and constructive role to play. How the clinical division, this new professional association and the society work together and making sure that we aren't fragmented and that we collaborate in a collective way is a crucial area that we need to get right.
The Association of Clinical Psychologists is a new body that's going to represent clinical psychologists. It will be led by clinical psychologists. We hope to have clinical psychologists as members, but also other people who are interested in the aims of the society who may join up. And we want to promote what clinical psychology is, what it can offer. We want to engage strategically with policy, with service development, and really make a contribution in terms of service design, service delivery, training, support for psychologists in terms of CPD, research. So it's exciting times, but challenging times.
So I think clinical psychology needs its own voice, and we've been hearing a bit tonight about how that might happen through other bodies. But I think it also needs to very much come together with other psychological professions, because coming together, actually, we can offer so much more to the public. So I've been here today talking about the Psychological Professions Network for Kent, Surrey and Sussex. It's a new network that we're establishing from Health Education England in the region. And it's going to be a free membership network for all psychological professions. What it does is it aims to give a voice to all the psychological professionals in particularly workforce planning, also bringing people together to help people deliver excellent care, and together we think we have a very strong voice that can make an influence.
I think it's exceptionally exciting that we might be able to do something a bit different that we've not been able to do before, and just to have a powerful voice for us as a profession.
I think it's all very new anyway, but it's even newer to me, probably, the sort of things that are going on behind the scenes, and so it's really interesting to find out a bit more about what is going on in terms of the professional body.
I think it's a really exciting time for clinical psychology, and people really need to get engaged in the discussions so they can influence how things are going to be for the future.
Clinical psychologists in their training cover a great breadth of psychological theory and practice, and they can, through that, contribute, I think, to the supervision, the training, the development, the research to develop the whole system of psychological healthcare. They can be architects in the system, amongst others.
It's about getting on board with a new body of the Association of Clinical Psychology to do something different and to be political in a way that we can't in the BPS, and to really do something about austerity and how we're working in the NHS.
I think that the new organisation and its structure really has the potential to do that. if people come forward and get involved.
There will be challenges because we're in a time of austerity, and so actually delivering this plan of expansion for the psychological professions is going to be very difficult to achieve. We've heard tonight about some of the challenges for funding training in the future. We absolutely need to overcome those.
The challenge for us, I think, is making it as inclusive as possible, but yet to be an effective voice for the profession. If we can capture the energy that there is within clinical psychology, if we can capture the very able people that we have who can come forward, get involved, we can really, really make a difference.